Folks, thanks for coming on with us today. My name is John Dubas with Premier Marketing, and we'll be spending the next hour or so going through the opportunities that we face as agents in the Medicare arena, working with low-income subsidy, extra help, and Medicare savings plans, and the opportunities they present to us in this area. They extend beyond just Medicare Advantage and Medicare supplement programs, because there are other programs that we can incorporate into our sales procedure by working with people in the correct manner in dealing with the numbers that we have with these folks. Today's presentation is being recorded, and it, along with much of the information we will reference throughout the course of the presentation, will be sent to everyone who has RSVP'd to today's presentation. And that includes the link to the recording that will come up as well. A bit of housekeeping to start. In the software package you're using to view this presentation, there is a questions section. And if you would, throughout the course of the presentation, if you have a question, please place that information in that part of the software, and we'll make certain that if we don't address that question throughout the course of the presentation, we will get you the detail you're looking for in the follow-up as well. A bit of background about our organization to start. We'll be working through a relationship that we have with carriers across the country as a national marketing organization that was founded in 1968. We're part of the Integrity Marketing Platform with offices across the country. We act as an insurance wholesaler, working with independent insurance agents, offering contracts through different carriers for different programs at the highest possible commission levels, with recruiting contracts available as well for those who qualify. As I mentioned, being founded in 1968, we recently achieved a milestone in our history, our 50th anniversary, and that's quite an accomplishment for what began as a small family agency in rural Nebraska that's grown into one of the largest marketing organizations in our space in the country. We do so through a full portfolio of product that include Medicare programs across the spectrum. The Medicare Advantage and Medicare Supplement programs are available, as are standalone Part D prescription drug plans. We do offer a full portfolio of life insurance and annuity products, including final expense life insurance and pre-need plans. We also offer long-term and short-term care programs, disability income programs, and ancillary benefits, including dental, vision, hearing programs, critical illness cancer plans, and hospital indemnity programs. The Medicare Advantage carriers that are available include all the national carriers and many of the strong regional carriers that can make a difference for you in your market, and that same philosophy carries over into the standalone Part D prescription drug program as well, where those national carriers are there for you through our organization. We do offer a impressive Medicare supplement portfolio as well, and offer different programs that can help you be successful in that space. We will address how Medicare supplements deal with low-income subsidy and Medicare savings programs in our program today as well. There are a couple of new programs here that are really worth noting. The new Ascendo program from CVS with the Aetna Association and the Humana Achieve program are both recent entries into the market and are performing incredibly well for agents across the country. Those ancillary products in each of those categories, the national leaders are there for you, and they offer a unique way of both working as a door opener, a way to make certain that we are covering all the holes and needs for our prospects and clients, and also an additional revenue stream for our agencies as well. When we look at the Medicare market overall, one, it has its own language, so we can get you some additional detail on decoding some of the acronyms, but it is a booming market, obviously. You don't come on a program like today's without someone espousing the aging of the baby boomers, 10,000 people a day, one every 10 seconds. The challenge is, if you look at Medicare based just on age, you're not seeing a full component of how that market actually breaks down, because you have a percentage of those folks who turn 65 that don't access their Medicare benefits immediately for one reason or another. Many folks are working longer, maintaining benefits at work. Some folks just defer that decision down the road. It's the decision to make a decision is a decision quandary, but you also have a big portion of the Medicare population that is actually under the age of 65 and accessing their benefits because of disability. It's about 1/6 the population. And generally, you can see from this graphic that those folks are really affected by the programs that we will address today. And many of them qualify for the extra help on their prescription drug coverage, and many of them need the assistance through either Medicaid or the Medicare Savings Programs. That population, in addition to having a full age spread, also has other demographics that require us to do our homework and make certain that we have the portfolio of products and knowledge in the programs to help address some of their needs. The base Medicare coverage needs some help, obviously, because these folks have a number of chronic conditions. 2/3 of them generally have 3+ chronic conditions, and they also have some challenges with their income and savings. And this is an area where we can address that circumstance with the extra help and Medicare Savings Programs moving forward. So as long as we know what we're dealing with and where these folks are, utilizing an outreach based on discovering people who need financial assistance give us an additional way to market, because it goes across the boundary of age, race, marital status. It also tells us that there's a good percentage of those folks that really need this help, and we want to make certain that we're able to address it through these different assistance programs. Because even though folks have a choice when they age in or pick up Medicare for whatever reason, they look at different ways of managing their costs, obviously. Some of them even start with that decision of, do I pick up Part B? Some of them don't do it and then pay for it for the rest of their life with a penalty, but there are some ways that we can help in that regard as well. Some of them pick up the Part D coverage alone, and that is, of course, costs that can really be addressed by the low income subsidy extra help. And then, of course, regardless of the choices they make on covering the gaps in the medical coverage, the Medicare Savings Programs can help them should they choose to go with the standardized, modernized Medicare supplement programs or through the Medicare Advantage programs, the Part C programs. Either way, our topics today will address many of the needs that are satisfied by either choice. What we're seeing with people aging into Medicare or coming into the initial Medicare enrollment, a better way to phrase it as it's noted on this slide, you're seeing a fairly even split with Medicare Advantage and Medicare Supplement, with a portion of the folks not appearing to make a choice at all. It's not always the situation, but we see here sometimes that choice is really influenced by the cost of the programs on a regular basis. You have a zero premium program that is being offered versus one that can run $100, $200 a month, in addition to picking up the cost of a drug plan. If you have a strained budget, sometimes that influences the decision, and what we talk about today will help with that. So you have a number of tools that can really help people moving forward with some of the challenges they have with their income or lack thereof. And many of those are available to the general public. And it's interesting to see how some folks respond to the outreach on Facebook, where 60-some% of the folks 65 plus are actually accessing that social media device. Ads for benefits checkup will go on there, and it's interesting to see the response where, no, I don't want to give them the information. So there are folks out there that could be getting additional help that just have a trust issue, and our role as an agent can really help them in this regard. In addition to some of these benefits checkups being subsidized by certain carriers, where they will help with pushing that knowledge to the public, It's also very important for us to be aware of, okay, what are the qualifications for these additional assistance programs? How can I help people access them? The National Council on Aging has some really good tools that can help you in that regard, as do many of the Medicare Advantage carriers, where they put a department in place that can actually help people in this regard. You do also, of course, have the social workers in the community. That is a little strained right now, of course, in our present environment. Many of those are placed in Social Security offices, and they're closed at present. So you can be of great assistance on the phone, electronically, and helping people get some additional help through this system as well. We beat it to death because there's a whole lot of people out there that need the help. A ton of individuals across the board and growing year over year that qualify for some of this assistance, and many of them do not have either an awareness of their eligibility or a means of accessing the assistance. So you've got some tools out there by the government. The Medicare and You YouTube channel is really, really good, actually, and it goes through and it speaks to ways that folks can save money when they're on Medicare, but we have to do it in a fashion that allows for different Medicare enrollment periods to come into play as well on our part, so we can influence favorably their health care choices, be it just with the base medical coverage or in prescription drugs. They're standardized for the last couple of years. Nothing's changed in that regard, where you have the annual election period. We're currently nearing the end of the OEP. Haven't seen anything that's speaking of perhaps extending that because of the COVID-19 situation, but there are a ton of special election periods that can come into play that give us an opportunity to help improve people's situation all through the year. Some of it's changed from, well, starting last year with the special enrollment period that is extended for folks with dual eligible or LIS status, but there were a ton of other steps that come into play as well. And one, of course, that's not on here now, where there is a SEP for a certain time period because of some of the challenges we've had with the weather recently as well. So this may be a bit of a review, but one of the things that changed starting the beginning of last year, January 1st of 2019, the SEP for folks in this category changed from a monthly special election period availability to one that is available once per quarter in the first 3 quarters of the year. There are certain folks that if they are deemed to be potentially at risk or at risk for some of the medications that are part of the opioid crisis, they may not have this particular SEP available to them as well. That's why many of the carriers in the Medicare Advantage world have set up the lines that will help you determine if someone has this SEP or if they've already utilized it for the quarter. Now, keep in mind, you don't have to take a lot of these details down because we are going to send you the presentation, not only the recording, but the PDF of this presentation as well. For those folks who think they don't run across these people, sometimes it's a question of, well, Pepe Le Pew and Penelope, did you ask? There are a ton of people that are enrolled in the Medicare Savings Programs, and there's even more that are eligible that haven't enrolled. So there are folks out there that you can really help that sometimes you don't expect. The circumstances in which you're visiting them, their house doesn't look like they're low income, or what is the circumstance? You can't judge the book by the cover, and sometimes it's just asking, I offer this service to all of my clients. One of the things we want to make certain that we do is maximize the benefits for which you're entitled. Is your income below this amount? And I usually use the 150% of federal poverty level because that at least will get them some partial help on the prescription assistance programs. One of the things that we can do because of this is it's interesting to see the folks that self-report fear or poor health heavily influenced by income. And if we're able to address this in our own manner as much as we can, we're helping the entire system overall. So it can really make a difference to these folks because they have different debt levels that they're dealing with, different challenges with inflation like we all do to a degree. But when you're on an absolute fixed income, as many of these folks are, the debt levels and the challenges with the month-to-month budget can be a huge concern for these folks. So let's look at specifically how low-income subsidy and Medicare savings programs can help you sell and keep beneficiaries, and how the two different programs actually affect the choices that people have down the road. When you look at either program, if anyone can qualify for these programs, they will obviously maximize the benefits that are available to them, minimize the plan challenges and choices and cost within them. And by that I mean, if a person individually qualifies for low-income subsidy, it affects the co-pays of the program they're on, the co-insurance they're on, and the coverage gap in the coverage as well. This is additional help to the individual, and when we see some of the challenges with the cost of medications, that's a huge difference. That also applies across the board to either program, and what it does is enables you to increase your current prospect pool. Because if they qualify for these assistance programs, obviously that special election period will come into play as well. One of the things that we see how these can affect our salary, so to speak, our renewals down the road, it makes a difference because you're doing obviously what's best for your prospect. It still gives you the latitude to offer multiple programs from different carriers. It makes someone else who would come in behind you, it gives them a much harder task to replace your product, so your persistency is higher. Obviously, it can enhance the program you're offering that may have less benefits, but this increases it beyond some of the competition. It creates that SEP if you need to use it. It helps you manage your time as well, because these folks, you have that special election period and you can schedule appropriately because you have that somewhat get out of jail free card. One of the things we've discovered obviously as well is the fact that if you're doing this service for an individual, it highly increases the likelihood of a referral. Folks like to talk about people who are like them. And generally, we hang out with people that are like us as well. So that gives us the opportunity to inquire as to, hey, who else do you know that might benefit from a program like this? And when you're dealing with these two programs, well, the lowest income of any of these to qualify for the assistance is 100% of federal poverty level. When you get below 100% of the level, you're into more true Medicaid programs, and these folks have a different mindset than the full dual beneficiary. And many times, the person that you deal with has a appreciation of what you're doing for them by getting this additional assistance because they're not accustomed to getting that help. So when you look at LIS, this gives you an opportunity to help anybody with Parts A and B to switch to a Part C program. It can affect the plan premium specific to that program and any penalty they may have associated for not picking up a program when they were first eligible. It affects the eligible or applicable co-pays, co-insurance, and coverage gap, lowers them, but it does not affect the plan formulary, step therapy, or quantity limits. So one of the things you obviously still would want to do with offering a standalone PDP or some of the medication coverages that differ in the Medicare Advantage programs is still do your homework, investigate the medications they're on, how they are affected by the different plan formularies, and other requirements within that system that could affect their plan choice. I like that so much, I obviously have put it in there twice, pardon me. When you also, it gives you the opportunity to switch programs. That's what this one is referring to. Even if they don't have the coverage or if they have additional different coverage, it still gives you the opportunity to do an evaluation to see if you can improve their situation. And if they are on a Part C program, it gives you that same opportunity as well. So if they're on a Medicare Advantage program, the same advantages come into play, but the same shortcoming of making certain that we check the medications they're on in order to improve their situation is also in play. When we look at the Medicare Savings Programs as well, it gives the individual that same opportunity to change. It can affect a premium that is applied to the prescription coverage within the Medicare Advantage program. You will see that occasionally. And if the person, once again, has a penalty, if it gives them the opportunity to waive that premium, or pardon me, waive that penalty. It can, of course, affect plan choices because some of the special needs programs have medications that are inserted into the formulary to address that particular physical challenge, and affects the cost of those medications once again. By qualifying for either program, low income subsidy or Medicare Savings Plan, it doesn't affect the drugs that are affected within the program you're offering. So the plan formulary doesn't change because of MSP or LIS. If there are step therapy requirements or quantity limits, those are still governed by the plan basics. One of the things that we can also see is if someone qualifies for this assistance and they're on a program, a Medicare Part C plan, a Medicare Advantage program, this does give the opportunity as well to work backwards to take the person back to traditional Medicare and perhaps a Medicare supplement and enroll them into a Part D program. So what we're going to see here is an opportunity to change plans, unlike some of the challenges you might have moving down the road with, gee, this doesn't apply to like a Medicare supplement, does it? No, it's still underwritten. This is more within the Part C and Part D world as to how it affects some of the changes within that system. So they can change programs, they can go to a new plan. There are other things that can come into play. That all bears in mind our information we discover through our fact finding to make certain that you have the differences laid out based on that person's situation, what drugs they're on. It's a key piece of it. Having a person get additional assistance for even the low income subsidy, it's a very valuable resource. The estimate of the value of that program for people who qualify are, well, it's right around $4,000 a year based on the latest numbers that were available that are a couple of years old. So the benefits for these extra help, obviously, kind of in review, it can provide access to additional prescription drug coverage or to help people that didn't take out the program, and it helps them with that donut hole. Even though that's supposedly closed, those folks are still subject 25% of the cost of medications through that time period, and that can be challenging, and that's addressed by low income subsidy. It does waive the late enrollment penalty into Part D, which is one of the questions that's popped up. It does allow for that special election period with a change available quarterly in the first 9 months of the year. And by picking up low income subsidy, it automatically puts them in a process to see if they qualify for even more help with the Medicare Savings Programs, which have, as we will see shortly, one of the key differences between LIS and MSP, where the Medicare Savings Programs will help with the medical cost and the Part B, not Part D, Part B program as well. So in order to qualify for low income subsidy, they got to have A and or Part B. They got to live in the United States, the 50 states or the District of Columbia. They've got to satisfy certain financial criteria, eligibility factors based on income and assets. And if some folks have other assistance, they may automatically get low income subsidy. So these are the folks that have any kind of Medicaid, either based on community qualifications or institutional numbers, SSI folks, or the folks that are in one of the Medicare Savings Programs. So it's not a second qualification process they have to go through if they meet one of those criteria. Generally, when they qualify for this assistance, they see that help for at least the rest of the year. Some of the things that we really need to take into account when we look at another reason why, if they're only getting partial qualification, is this going to help them all so much? Well, anybody who takes a number of medications has realized the inflation trend based on some of those drugs. We see drugs out there that are on the market for over 40 years, and they see a COLA of sorts of almost 6% year over year. And we've seen generic medications that have prices increased on a multitude of levels. So it's really crazy in the fact that many of the pharmaceutical companies will also take an older generic medication, make it time released, combine it with another drug, kick it out as a new medication, and you'll see the drug costs are flipping high. And if we don't go through and utilize this assistance program and the analysis that is the key component of it, going through that individual's situation, we may be costing them a lot of dollars, and ourselves too, because we don't have the opportunity to change their coverage to something more appropriate. Because obviously the formularies can change year over year, and some people, well, they have an opportunity to examine their coverage during AEP and OEP and don't. And in addition to the formularies changing, the drug might stay on the list, but it might change tiers. And that's where low income subsidy can be of great help as well. So if you ever needed another reason, well, keep in mind, even if, what's the expression? The more things change, the more they stay the same. You got to have an analysis to help these people look at things year over year. The Extra Help program does have two different levels of assistance, the full subsidy and the partial subsidy. It's based on their income and their assets. And both of these subsidies eliminate that coverage gap, helps deal with that 25% that we see this year going into it, and that late enrollment premium. For folks who qualify for the full assistance, there's no Plan D premium, so if they're on a standalone drug plan, or if they're being charged prescription component cost within an MA plan, as long as it's below the benchmark, which is normally around $32 a year, it's going to take care of it completely. It eliminates the deductible they may have on the plan. So if they've picked up the least expensive standalone Part D program and they qualify for this, that nearly around $400 annual deductible that comes with many of those programs are satisfied by the program, and it standardizes some of the costs that they see based on generic versus name brand drugs. This is a great way of determining if a person already has this sort of assistance. And it eliminates the copays they have once they've reached the catastrophic limit. These are the numbers for low-income subsidy for the continental contiguous United States. So the 48 states that are part of one whopping piece of our government or our space in the United States, it gives you the numbers and the difference between these different levels of assistance. So this is taken from the National Council on Aging, and a standalone piece with this and some of the subsequent slides will come to you very shortly. So in this particular circumstance, what you want to look at and keep in mind when you visit with any of your clients, I offer this service to make certain that we maximize the benefits that you are entitled to. And so as a single individual, is your income less than about gross income, less than about $1,600 a year? If they say yes to that, it's like, well, we also have a asset requirement, and these are liquid assets, so it doesn't include a house or a car. Is it below, well, as a single person, around $13,000? That gives you an idea if you're dealing with a single individual, or the couple numbers are here as well. Can you get them some help on their medications? This gives you the number for those two non-contiguous states, Alaska and Hawaii. We don't generally spend a lot of time on these two slides because we don't normally get a lot of agents that come on the line from those two states. If a person qualifies for partial subsidy, it still helps with the premium based on a sliding scale. That's part of the information that was laid out before. It also helps with minimizing the deductible and the co-insurance they may have, and they have a slightly higher standardized copayment for the medications. And this will give you those information again on the partials for Alaska and Hawaii because they're different. How a person can acquire this coverage, how they apply for the extra help, well, they can go online at Social Security's website at ssa.gov or through benefitscheckup.org. They're under the resources tab and complete the application. It's available in either English or Spanish, and they accept that electronic signature to complete the application. One of the things that we can do as agents is help our prospects and clients with this because we can act on their behalf compliantly as their advocate. There are paper forms available, which are available from the Social Security website or the office, and the person can complete them and deliver them and mail them back if they choose to do so. I would strongly recommend going electronic. This process, particularly now with the Social Security offices shut down during the COVID-19 crisis, it takes a heck of a lot more time, and boy, you got a whole bunch of uncertainty layered in there if you're going paper. The benefits checkup site that we referenced earlier can be a great help with this as well. And of course, the state health insurance assistance programs, the SHIP programs, can help with this regard. The challenge you have in many circumstances, if you take this out of your own hands and defer to a third party, is you are giving up a bit of control with that individual, because once that coverage comes into play, it's when it's approved, when that special election period comes available for them to change coverages. We obviously want to make certain that we do what is best for our clients and our prospects, but we also want to make certain that we're aware of the timeline that they have with these assistance programs and when they're eligible to change coverage if it's in their best interest. Obviously, as I mentioned before, online is easier and faster. It doesn't require verifying documents to be submitted with the application itself, either online or through the paper process. Social Security Administration is going to use federal records to verify answers. If the paper form's incomplete, Social Security will follow up with a phone call with the applicant. We know what that means. There's a delay. The online application, it's much like the experience we have as agents when we're doing an electronic application for an insurance program. Can't be submitted unless it's complete. And of course, there are help programs available for folks where the instruction sheets for this process are available in 15 different languages on the Social Security website. So remember, once again, the folks that are deemed eligible for LIS, the folks that have the other assistance programs already, don't need to reapply for LIS. They automatically get it, and they get a letter from the Centers for Medicare and Medicaid Services that let them know that. This is what the online application looks like. This is the paper application. This is the letter they receive with the approval or denial, and it's normally done within a week and a half, 2 weeks if it's done online. It can be 3 weeks or longer if it's done by paper, particularly now. Once again, when they are approved for this assistance, it does qualify them for that quarterly special election period. They can change each quarter should they choose to do so. Why would somebody do that? Well, their medications might change, or there might be challenges with a medication coming off the list, which is possible, because if a program has a medication on their formulary and it becomes available over the counter, it comes off the formulary. And so these people don't have to wait for the enrollment periods, open enrollment period, the annual election, or the next OEP in order to make those changes. Remember that quarterly special election period's something new as of last year. You have some additional resources here that can help you understand the low-income subsidy programs. These links will come to you as part of the presentation follow-up, and it'll get you some additional detail on some of the income and asset levels. Remember, I've got those particular documents pulled for you and will be sent as part of the follow-up to today's presentation. When we speak of the Medicare Savings Programs, what we're doing here is we're taking the next step in additional assistance, but it's also predicated by a lower income and lower assets test. This is a nice piece from the National Council on Aging's website that describes the Medicare Savings Programs, and it can help us as a tool, if you're unfamiliar with these, to understand some of the differences. And if you go in wired for sound with your appointments and you want to get help explaining these to your prospects and clients, it's a good way to do it. Medicare Savings Programs are Medicaid administered programs. They help cover the Medicare premiums and cost sharing for the folks, whoa, dance there on you, that, there we go, don't qualify for full Medicaid. They can be known by different names in different states. And as a piece here, bear with me just a moment. This is one of the, oh, I managed to shut it off, darn it. It'll come to you, and it lays out the definition of some of these names in the different states. So you'll have another guide that's going to help you with your terminology in your particular market. The different levels of assistance, the three that are most commonly encountered, three of the four, are created by different pieces of legislation. They have different enrollment percentages within them and have different benefits that come with them as well. The qualified Medicare beneficiary, the QMB or QMB, that's legislation clear back in '88, and there's a good percentage of these folks, majority of these folks that are eligible, that aren't enrolled. So, same with the specified low-income Medicare beneficiary, the SLIMB or SLMB, created by a later piece of legislation, a couple years later. A bigger percentage of the folks that are eligible for this aren't enrolled. And then the QI1s, the qualified individual ones, that were created by even later pieces of legislation that can come into play, and they're funded differently as well. To be eligible for one of the Medicare Savings Programs, you got to have Medicare Part A, you got to meet the income and assets requirements, and these can vary from state to state. We see higher income limits available for the two non-contiguous states, Hawaii and Alaska, but there are also additional states that do not have the resource test. So the assets test doesn't come into play. What makes a difference for you with that? Well, if you work in one of the states that has the assets test, you're dealing with someone that moved to your state from one that didn't. They may qualify in their previous residence and not qualify in their new home. These programs are generally submitted through the local Medicaid agency or through Social Security offices as well. And once again, this can be initiated by completing the low-income subsidy application. I wouldn't wait on it, particularly with the backlog that's in there, and do a separate qualification request for the Medicare Savings Program, but it can be done with a single piece if the person's patient. Eligibility for these programs are generally redetermined each year, and it's right about now where the new income levels, qualification levels come out. And so we have those as well that we'll go through here in just a little bit. It does take care of the Part B late enrollment penalty if a person qualifies for these assistance programs. So that monthly Part B deduction from their Social Security check is covered by this program. So when a person qualifies for this, they see their Social Security check, if they're getting one, go up the Part B cost that they're currently being charged. These are different than Medicaid programs that a person are subjected to. Some of the rules they're subjected to if the individual goes into a nursing home, where some of those programs do allow for recovery of different assets. This does not. And these folks, once again, they qualify for an MSP, they automatically get the assistance on their medications. You've got different organizations dealing with this process when you deal with the Medicare Savings Programs. The LIS program, it's the same across all the states. The same income, same assets test apply except for Alaska and Hawaii. These programs can vary as we went through before. It also has different organizations that deal with determining the eligibility. So you got the federal government and the state Medicaid agencies supposedly working hand in hand to make certain that the benefits are properly administered once the person qualifies for them, and they are part of that qualification process. Remember, it excludes a house or a car regardless of their value. One of the things that we'll see sometimes is a low-income person that may have enough liquid assets that are above the limit, and they have some challenges with, well, what do? Spend down? I already have a trust for my funerals, take care of my funeral. What am I going to do? Well, an improvement put into a house or into a car, a single one of each, that can help drive down that liquid test. It also, keep in mind that sometimes it's like, oh, well, I'll just give it to my daughter. They'll recover that if you give it to a family member or a charity or whatever, and that can be a challenge in the qualification process. So you've got these particular programs that we're going to go through on an individual basis for 2020 numbers. So for a qualified Medicare beneficiary, they've got to be at 100% or lower of federal poverty level and have resources below $7,860 a single, $11,800 if married. The qualified Medicare beneficiary status qualifies for coverage for the Medicare premiums, the Part A if it's applicable, if they didn't have enough quarters, and the Part B voluntary deduction from their Social Security or what they're paying quarterly if they're not yet claiming Social Security. It also helps with the deductibles, co-payments, and co-insurance that they may have for Medicare in their particular area. There is a $20 general income disregard, and as I mentioned before, Alaska and Hawaii has slightly higher limits. So if you're in the states contiguous and the District of Columbia as a single person, your gross income limit is $1,083. As a couple, it's $1,457. Why do you keep beating that to death, John? Well, a lot of people that fall into this category, their only income source is their Social Security check, and they'll tell you what that check amount is. Well, keep in mind, that check amount is net of that Part B premium being taken out of it. So what you have here are the federal poverty level for single and married individuals, because this is 100% of federal poverty level right here. Different for Alaska and different for Hawaii. We also see the qualifications then change for the individuals that might qualify as a SLMB, a specified low-income beneficiary. These folks can have income up to 120% of federal poverty level. Same assets tests apply, and what this covers for them, unlike the QMB program, which covers the premiums, A or B, and the out-of-pocket costs for the medical, this covers the Part B premium, which standardly it's $144.60 if you're not affected by IRMA, the higher income folks. It also has that disregard, so you've got higher limits here. So what you have, where here, this is 100% of federal poverty level. Here we're looking at the max, that's 120% of federal poverty level. When you look at, deep in there, the qualified individual, the QI1, this is a program that's available to folks with income up to 135% of federal poverty level, same assets test, and it, like the SLMB, covers the Part B premium. So what we're seeing here is 135% of federal poverty level. That translates for the continental United States, $1,456 for an individual, $1,960 for a couple. Same assets test, all three programs. The other program is one you don't run across nearly as much, and it's a qualified disabled working individual. These are folks under the age of 65 and disabled that have recently returned to work. They have a higher federal poverty level qualification. It can go up to 200% of it, and it has a lower assets test, if you notice. So if you're looking at 200% of federal poverty level, those are the numbers for the continental United States and the numbers for Alaska and Hawaii. Why do we beat this to death? Well, it gives folks on Medicare an opportunity to save money on the cost that they're associated with, if in any of the programs, at least for the Part B premium, which if you're looking at 135% of federal poverty level, and that's this number, and that premium is $145 rounded up for the Part B, it's about 10% raise in their disposable income month over month. So there are different things that come into play here that can be helpful. Once again, too, it's a deeming process for folks that have the local assistance as well. Bear with me here. These give you the numbers across the board and the benefits. This, once again, taken from the National Council on Aging with the different levels of assistance in the different levels or in the different areas in which you're visiting with an individual. I don't know of a lot of folks that are in the continental United States that deal with prospects in Alaska or Hawaii, but you might be one of them. Challenge is dialing in Hawaii, the time zone, and they don't like mainlanders talking to them anyway. Didn't mean that they sound like it did, but you know what I mean. It gives you the details you need for those numbers for all four programs. Keep in mind, this will not only come to you as part of the presentation, but as a separate document obtained from the National Council on Aging as well. Why earlier did we talk about so many people qualifying for this and not having the coverage? Well, the government did a very good job of publicizing the assistance that a person can have for low income subsidy, the extra help program on the prescription drug plans when Part D plans rolled out. They haven't really done as much, in my opinion, in publicizing the information about a Medicare Savings Program. So some folks, they don't know they qualify for it. They don't know such a program's even out there. And for some folks, it's a difficult qualification process because the application, it's not all that condensed, we'll put it that way. And sometimes the print's really hard for them to deal with. Even if they know of the program and they know that they can get help in qualifying for it, sometimes because of the challenges they have with their finances, it's even hard to get to the place to get to the help. And there are some folks, when we deal with a very proud generation, that misplaced social stigma on it, that they're on welfare. They don't want that label, whether someone knows about it or not. So we'll run across some folks that don't know, and we'll run across some folks that are challenged by their present situation or embarrassed by it and don't want to deal with it. So you can do different things to help them, and I apologize, I'm going long here. I'm going to fly through some of these slides here. You can help that person by sending them to the Social Security office when they reopen and have the social worker there help them, set up appointment ahead of time, or you can use, well, My Advocate's a program with United Healthcare benefits checkup. I know both Aetna and Anthem run with it. Humana has a separate program that they use as well to help people get qualified for it. If you're dealing with a Medicare Advantage program and an individual like this, and they work in the dual special needs area, they've got some programs that can help you determine the SEP codes and the assistance that a person might be eligible for and roll with. So you have some real help with Medicare Advantage carriers that work in the D-SNP area. And I got to tell you right now, there's a ton of them out there doing electronic trainings on this topic, not only on the program that's offered by that particular carrier, but also on these different assistance programs, and in many cases, marketing programs to help address this portion of the market. So one of the things you want to be really careful of is if you're working with an LIS individual or a person on one of the higher income MSPs, the SLIMB, a QI1 or QWDI, most of the dual special needs programs want the individual that qualifies at least for the QMB or QMB plus coverages in different states, just different terminologies. In order to qualify for those programs, they got to have A and B. They got to have the full assistance in order to maximize the benefits. They got to live in the service area, and at least this year yet, they can't have end-stage renal disease. So it's something that we need to be aware of, because if we're putting a SLIMB or a QI1 person on a dual SNP program in a particular area, and they don't have that assistance for the medical costs, you'll see on those dual SNP programs, those are higher out of pocket than a regular MA program in many cases, because the Medicaid assistance covers that shortfall. And we want to make certain that we're doing right by our prospects and clients as well. You can identify where those plans are, what are available in your area through the plan finder on Medicare.gov or through some of the electronic tools that are offered by contracting organizations such as ours. Our Medicare Center program can help. And you also have to be aware in certain states of an MMP program, a Medicare Medicaid program, which is a trial program that's been going on for a number of years in certain states, where the federal government and the state combine those coverages into one. That is something that we go through in great detail for an individual in different states through the SNP training programs that we offer. We do have recordings of those online, and that links to some of those will come to you as part of the follow-up as well. In Texas, that's those MMP programs. You'll notice they're in the highly populated areas, and it can be a challenge based on which carrier you contract with and who is managing the Medicaid benefit in that particular market. So if you want to look at this and take it beyond and to the Medigap area with Medicare supplements, who with a Medicare Savings Program needs a Medicare supplement program? They don't. QMBs shouldn't be sold a Medigap policy. And there are different suspension programs that if a person qualifies for QMB, where they can go back to the Medigap coverage based on those timings. If you have someone that's a SLIMB or a QI1, and that only pays their Part B premium, assessing their needs on a Medicare Advantage versus a Medicare Supplement program, factoring in their budget, well, for those, it may be appropriate in certain circumstances. If you are dealing with folks that are getting long-term care Medicaid, even if they're in the community or in residential facilities, that's a challenge. That's one I normally stay away from, simply because they may have systems set up with folks through social workers who are getting them assistance outside of the area, particularly in some of the lower benefit programs. Some different assistance that will come in here to help you understand the different pieces that come into play with Medicare Savings Programs are here available for you. And if you really get into the area of working with low-income individuals, the National Council on Aging has a ton of different educational programs available for you that can be used in the community, either electronically now or as we're allowed to get into the public again. These can be a great seminar PowerPoint. So you have them for the SNAP program. It used to be called food stamps, pardon me. Low-income home energy assistance programs, where you have details for that. The folks that are below 100% federal poverty level, the SSI people, you don't generally see them. Well, you do, but you see them in different types of environments in order to reach that particular population. Generally, my experience, having done this since I was the regional for the SNP products for United Healthcare a number of years ago. You get below 100% of federal poverty level, you have a different attitude about the programs. You also have a different opportunity of cross-selling those individuals, so that can make a difference to you. Some of the things you get from us here at Premier that can help you, if you're looking to contract with multiple organizations, using the Assurance Bay system does give you a great flexibility in creating an agent profile and electronically contracting with multiple carriers. We offer discounted E&O, so regardless of who your upline is for whatever program, as long as one of them's with us, you can have a true independent insurance agent errors and admissions program. It'll cover you regardless of who your upline is, as opposed to being added as a single individual on a blanket E&O for one program. This is going to cover you across the board. We also help you keep your insurance license in play with discounted CE bundles through our association with WebCE. If you look to address your own benefit package, we do have a program that can help you obtain non-cancelable DI coverage on a modified guarantee issue basis, discounted, and you share in the commission on those programs. So if you're looking to expand your own benefit package, it can help you. We do a ton of these different webinars. They are recorded. They are available on our website. We have a singular document that lists them all as well. They are also available on our YouTube channel. And it doesn't deal just with concept. You have different product trainings on there as well across the board for our entire portfolio. Some of these different marketing techniques, well, they apply regardless of some of the products that you're offering. So working with faith-based organizations, life insurance and final expense, short and long-term care are great topics to rotate through with those organizations, in addition to the different programs we have for you in the Medicare space. So a ton of information available to you that way. And we offer electronic support that can help you sell. So quoting tools for Medicare supplements, enrollment tools for Medicare supplements, and Medicare Advantage and prescription drug programs, programs that will help you electronically obtain a scope of appointment and store it like you're supposed to, whether you sell it or not like you're supposed to, in either one of our electronic systems for Medicare SUPs and ancillary programs or Medicare Advantage and prescription drug plans. We do also make certain that you are aware of the different compensation packages that are available to you from the different carriers. The space we're talking about today for Medicare Advantage and prescription drugs, particularly, the production for those don't normally come with additional incentives because of the standardization of the compensation dictated by CMS. The other programs all do, and it helps you qualify for our trips as well. This recently canceled one like everyone else. This year it was supposed to be a cruise from Miami to the Bahamas. They're about to roll out next year's, hopefully soon. We have some different programs that can help you reach out into the community as well. Custom contact list, calling list for programs that are available to cold call. Obviously, you can cold call for Medicare Advantage or prescription drug programs, or you can't really cold call to say, hey, I'm offering you these assistance programs either. You got to watch your compliance factor on there as well. But we do help you also with maximizing community-based programs to deal with centers of influence in your community. And those may include the different retail programs offered by carriers or by the Walmart program, dealing with the faith-based community. We had a webinar on that yesterday, and with working with providers, be they doctors or other providers of care that are accessing or delivering the care, I should say, of the programs you're offering. So even from dentists, in addition to doctors and hospitals. Some of the carriers do help in generating prospects. That is generally a symbiotic relationship you develop with your local market. We can help influence that, however. We do have different internet lead programs available as well for final expense, and for recently rolled them out for the Medicare program as well. We do still offer direct mail support, which is based on production that can deeply discount the cost of a 1,000-piece mailer through our preferred lead vendors. We use preferred lead vendors because we help make certain the communications are compliant for you. We don't want to put you in compliance hot water by utilizing a letter that may get a great return, but there's probably a funky reason for it. All said and done, what we're looking for is an opportunity to earn your business. So right now, let's take a peek at some of the questions that have come through that I haven't addressed yet. Luis, I am going to call you with specifics on this. Keep in mind, much of the information we talked about with the collateral material will be coming as part of the follow-up as well for everyone. Let's see. When we deal with folks, let's see, if someone is a recipient of LIS, can they get into a health insurance program throughout the year? It does create that special election period once per quarter in the first 3 quarters. The last quarter, they've got to qualify for a different SEP or go through the AEP as anyone else. Much of the information that you see that comes to you by video, you are able to link to that if it is a third-party source such as Medicare, the CMS programs, or the National Council on Aging. If you want to link in different carrier videos, that's a different animal. You've got to get permission from the carrier, and they're going to look at your site. Let's see here. Some different things when it comes to talking about driving down the assets test. Those are some specifics that I'll get to that individual. Income deduction or deductions from income for rent and child support. George, that can vary, and based on the number of people in the household, I'll make certain that we include the details of that as part of the follow-up. The rent, I don't mean squat when you're talking about MSP or LIS, unfortunately. One of the things that you have as a reference material, if you don't know the answers, that's why we are looking to make certain you have the data in front of you that you can refer to. You want to memorize all those income and assets tests for each area across all those benefit packages. You're one up on me. What I normally do is I look for the income and assets test of the highest amount of income, speak to that and say, hey, we may be able to get you assistance if your income and assets are below these levels, and that will be determined by that income and that assets. To guarantee someone that you're going to be able to get them this assistance is a great way of putting yourself in hot water. You don't guarantee squat. You're not the one determining whether or not someone gets this assistance or not. If those questions come about during working hours, generally you have someone that can help you with that process as well. And I got to tell you, if you're working with a carrier with a program, their producer help desk across the board, I got to tell you, they're really good. Anthem's really good. United Healthcare is really good. Humana is really good. There's some different companies, and I don't mean to leave one out, but they can really make that difference for you. Let's see here. Some of these things are individual questions, and we'll address those with that individual. These packages of information do come out as attachments to each of the webinars, and that has someone in different circumstances. So the challenges I have with some of that getting through, I got to be careful about too many links or too many attachments, because we're all encrypting as we should, and sometimes your software will pull that into your spam. So one of the things you got to watch is, boy, did it go into the wrong folder here. George, on the SSDI person, pays half his check on child support. God bless that individual, but I'm going to have to look into that because I don't have the answer off the top of my head. So we'll get that rolling for you. That all said, we want your business. We'd love to work with you. This, I think, is a crucial part of a program, and I think a lot of times when we get into discussions about these type of assistance programs, people automatically say, hey, they got Medicaid. What we're looking at here is a population above that qualification that really need your help. You can really positively influence their day-to-day life, and it's not being addressed as much as some of the other categories. It's just a question of knowing enough to be dangerous, getting that experience in manner of speaking, because you don't have to have all the answers all the time. You just got to be able to ask the questions to a person that gets you those answers. And we can do that for you. So we want to earn your business. We want you to consider this very seriously as part of your overall marketing program. Study up on the information we're going to send you. Qualify in your mind how you can approach this market and what you're going to work with through it. Study. Attend not just these programs or visit the CMS and Social Security websites and whatever, but if you have a carrier that you're looking to use with this, be a bug in their ear, most certainly. As I mentioned before, they got a ton of trainings out right now. It's a great way of making certain that you're doing the right thing for individuals. It's the right thing for you as well. Because I got to tell you, when you deal with the lower income market, it's a longer appointment because you're going through a lot more detail. You have people that can enroll every quarter. They can disenroll every quarter. My friends at United Healthcare swear to God to me that persistency on these programs is the programs that are affected by DSNP are slightly less persistent than the others. If you're doing the right thing for a SlimB or a QI1, you're putting them in a regular program anyway. Those folks are going to love you. They're going to give you a ton of referrals. And this is something that, once again, John Wayne fan here, Cowboys have been on the Grit channel quite a bit. We're burning daylight. Take the information we send you, study it. You have questions, let us know, and let's get rolling with this as part of your program. You can reach any of us here at Premier through our toll-free number, 1-800-365-8208. Luis, I am calling you, or will call you. And keep in mind, you can also access information off the Premier website at premiersmi.com. I want to thank you. I ran longer than the hour. We had a lot of details and more questions than I had anticipated. Watch for the follow-up. We look forward to the discussion we'll have in the very near future. And in the meantime, stay socially distant and good electronic selling to you. Thanks so much. We'll talk to you soon.